So this came out today from the Epoch Times. A psychiatrist from Gender Clinic warns gender-affirming care will lead to mass sterilization. Yes, I doubt this will stay up very long, but it just shows you how unethical the people are that are refusing to report the truth. A London psychiatrist who spent 12 years working with children at the United Kingdom's government-funded Tavistock Gender Clinic is warning that transitioning patients to a new gender identity isn't the answer to gender dysphoria. No, it's not. And as I've been saying, and he goes on to say, it's equivalent to us affirming delusions of schizophrenia patients. Although today you really don't know. Because with what the science, I mean, just because many schizophrenia patients say that the FBI is following them and, it's all that kind. But I'm just saying, we don't affirm the delusions. Countries embracing gender-affirming care risk needless mass sterilization, Dr. Oz Hakim told the Epoch Times. He is the author of a new book, Detrans, When Transition is Not the Solution. Quote, I say affirmation therapy identity isn't the answer to gender, I say affirmation therapy is not therapy, it's grooming. Grooming them to accept the idea that they were born in the wrong body, said Dr. Hakim, a fellow of the Royal College of Psychiatrists and honorary associate clinical professors at University College London. He predicts in the next 5 to 10 years, society will see a mass number of so-called detransitioners, I've said this too, people who try to reverse steps they took in an attempt to medically change their gender. That's because of an expected 8,000-fold increase in patients undergoing procedures and taking medications meant to try to alter their gender. I'm critiquing the whole of gender ideology, he said. His book, he said, debunks all the myths and dissects transgenderism. When a person is feeling confused about his or her identity, he or she may assume that it has to do with gender, especially with the current climate of affirmation of that kind of thinking. It's a false solution to a different problem, Dr. Hakim said. The cause of gender dysphoria or unhappiness with one's gender often are linked to autism, underlying trauma, or internalized homophobia. In many cases, vulnerable children are groomed to transition, often by parents, teachers, doctors, governments, or social media influencers who plant the idea they might be transgender. It's the only medical intervention that I know of which there was no evidence. There are no outcome studies for this. To medically castrate children with hormones or surgery is akin to the use of lobotomies or thalidomide in the 1950s and 60s. Thalidomide was a tranquilizer given to pregnant women around the world, resulting in thousands of severe birth defects. A lobotomy is a surgery that disrupts nerves to lobes in the brain. It formerly was used as treatment for mental illness until the practice was deemed inhumane. There have been enough dissenters to pause, at least temporarily, the headlong plunge into gender-affirming care in the United Kingdom. Yeah, in the United Kingdom, they have pulled back from it, but not us and not Canada and a few other places. But it is still a popular course of action there and across Europe. The mental health profession has been captured ideologically. That's what Dr. Hakim said. Even to the point of affirming children's beliefs that they are cats and dinosaurs. He sees the presence applied to people to coerce them to agree with gender ideology and ignore science as Orwellian. That's a term often used to equate happenings today to the dystopian future totalitarianism state described in the 1949 novel by George Orwell, 1984. In the literary classic, the pragmatist eventually succumbs to pressure to write 2 + 2 = 5, even though he knows it's incorrect. That's much like how people are expected to affirm adults and children who say they were born in the wrong body. Though Dr. Hakim no longer counsels patients on matters of gender identity because it's too politically dangerous, he does meet with parents of children with gender dysphoria. Let me jump ahead here. He did a stint working at the Gender Identity Development Services, the Gender Clinic for Minors at Tavistock Center. And for people that don't know, Tavistock is all about researchers, and it's where all your psychiatry, much of it comes out of. It's been there a long time. He said that Clinic for Minors at the Tavistock Center was disturbing. GIDS, which is the Gender Identity Development Services, started as a small part of the clinic that's funded by the National Health Services, but it grew and took over. It was there Dr. Hakim encountered incidents of what he considers Transhausen by proxy. The term refers to parents who want to transition their children to a different gender to meet their own narcissistic needs. It's adapted from Munchausen by proxy, a medical condition in which a parent or caregiver invents medical problems of a child in his or her care in order to gain attention. The UK government has ordered the Tavistock Gender Clinic to close, and this is scheduled to happen in the spring 2024. And it's closing over the concerns that the diagnosis of gender dysphoria were being confirmed in patients with little investigation into the cause. The review found no solid evidence that treatment with puberty blockers or hormones benefited patients. My role every week, my role was every week to challenge and be a troublemaker, standing up for what I thought was common sense. I totally feel his pain there. While they were just a transition factory for little kids. The Epoch Times reached out to the clinic for comment. In an emailed response, a spokeswoman who declined to be identified by name, quote, GIDS works on a case-by-case basis with every young person, their family, and local services, working thoughtfully and holistically with them to explore their individual situation with no expectation of what the right outcome for them might be. Dr. Hakim recalled how the parents of a 4-year-old boy discussed steps they were taking to transition him. Quote, parents who are saying, oh yes, well, Johnny's told us that he's a girl and we've told him he's trapped in the wrong body. We bought him a wig. We've told the school we're changing his name. He knows he's going to get puberty blockers. Things that didn't change after he left. Some 70 children under the age of 5 were referred to the gender clinic from 2010 to 2022. That's according to their own data. Dr. Hakim remembers thinking that most of the children coming through the clinic would resolve their dysphoria over time. Yes, because many just grow out of it. We know now that kids do just grow out of it. So, yes, and he goes on to say that basically we should not be doing affirming care. I've been saying this for, I don't know, going on 4 years. That we should not be doing it either because we don't affirm delusions, and it's a delusion. It has nothing to do with being transphobic. It has to do with doing the right thing, and unfortunately, we just don't have people that think it's a big deal to do the right thing.